Joining me today is Alyson Smith, Executive Officer at the Nursing and Midwifery Board of Australia. She'll be speaking at IIR's Clinical Training and Workforce Planning Summit, which takes place on the 29th to 30th of August 2011 in Melbourne. Alyson, thanks very much for joining me today.
Thank you.
First of all, what's the key to balancing public protection versus that of the nursing workforce?
I guess the key from a regulator's point of view, and that's who I'm representing today, the Nursing and Midwifery Board of Australia, is there are a number of key objectives and guiding principles that support the National Registration and Accreditation Scheme that was implemented across Australia for 10 health professions, including nursing and midwifery, on the 1st of July 2010. Western Australia came in a bit later, on the 18th of October 2010. And the aim is that in regulating a health profession like nursing, that the board needs to balance its guiding principles and objectives that are enshrined in the national law, and that law is the Health Practitioner Regulation National Law Act, and that's adopted in each state and territory to implement the national scheme. And the guiding principles and objectives, and in particular the objectives, were to protect the public and ensure that only those who are suitably educated and qualified to practice in what we consider a competent and ethical manner are registered. But it's also to facilitate workforce mobility across Australia by reducing the burden of individual state and territory regulation, which was the past model. It's about making sure that we facilitate the provision of high-quality education and training for those nurses and midwives that are registered. It's making sure we assess internationally qualified nurses and midwives in a rigorous and responsive manner, that we make sure that the health practitioners we register are sufficient to enable access to services by the community. And the balancing against all of public protection and making sure the community is protected is ensuring that there is a flexible, responsive and sustainable workforce, and that there is innovation in the education and training of those nurses coming into the workforce, both at registration and for endorsement in special areas.
And what are the objectives and guiding principles of the National Registration and Accreditation Scheme?
I guess I've reflected on what are the principles and objectives, but the guiding principles, particularly, that were identified by the Council of Australian Governments in March 2008 when this new arrangement was first proposed, was that they wanted a national scheme for registration and accreditation of the 10 health professions. And this scheme needed to operate in what they saw as a more transparent, accountable, efficient, effective and fair way. It was also they wanted to see registration fees that were reasonable for registrants, but having regard that needed to provide for an efficient and effective operation of the scheme. And there are a lot of new initiatives for public safety that are within the new national law that need to be funded within this scheme. And they also wanted to make sure, as a guiding principle, that any of the restrictions on practice through regulation that may be imposed would only be done to ensure that health services and the practitioners that provide those services are provided in a safe and appropriate quality.
Can you explain then the new role for the Nursing and Midwifery Board of Australia?
Essentially, the role of the Nursing and Midwifery Board of Australia is to regulate the nursing and the midwifery professions, but clearly I'm focusing on nursing today. And this is across Australia, and it's in accordance with the powers that are outlined in the national law. The board itself does this with the support of the Australian Health Practitioner Regulation Agency, which is commonly known as AHPRA. And AHPRA has a national office in Melbourne with an office in each state and territory. And it is AHPRA that actually does the day-to-day work around registration, notifications, and it is the board, the national board, that oversights the policies and the registration standards and the codes and guidelines that are required to manage that. And the board itself is responsible for a range of functions, and there's a number of them, but the main ones are around determining what are the requirements for registration or endorsement of registration, and the assessment of overseas qualified nurses and midwives. They approve the registration standards for entry, as well as the professional code standards and guidelines. And these are designed to provide the guidance to the nurses and midwives, but also to inform the community as to the professional standard of care that they can expect of a nurse. The board approves accreditation standards that are developed and accredited by an independent authority, and that authority is the Australian Nursing and Midwifery Accreditation Council, and commonly known as ANMAC. It approves programs of study accredited by ANMAC, and these lead to registration or endorsement. It deals with the receipt, the assessment and investigation of mandatory and voluntary notifications of nurses and students of nursing, and it deals with it in the sense that it oversights those, and AHPRA itself is the deliverer of that service. It establishes panels in state and territories to conduct hearings into the health or the performance or the professional standards of nurses, as well as health matters for students. It refers notification matters to tribunals in states or territories. It maintains a public register so that people can identify that a person is currently registered, and it monitors the conditions and suspensions imposed on registrants. It also provides advice to the Ministerial Council and obtains their approval on the registration and accreditation standards, as well as the professional codes and standards. So it's quite a large remit, very specific and very much guided by the national law.
Why is regulating the professional nurse important, and what are your thoughts on the effectiveness of the current professional code, standards, guidelines and policy?
Regulation of the health profession is important in that it sets a standard against which entry to the profession is clearly regulated in terms of ensuring that people are educated appropriately, that they are a fit and proper person to be on the register, and that they will practice in accordance with the board's professional codes, standards and guidelines and any other sort of policy statements, because that provides a professional practice framework from a regulatory perspective. It provides guidance to those individual nurses and midwives as to the expected standard of safe and competent care in nursing, but it also informs the community, the employers of nurses, the educators of students as to the expected professional standard of care that the board would expect of a registered nurse or an enrolled nurse. And it's a framework that is constantly being under review. It's an important and dynamic approach to the way in which we regulate, and it's continuously informed by new evidence as well as the voices of the professions, nursing and midwifery, the community and other stakeholders.
Do you think current nursing and student education standards are up to scratch, and what do you think needs to be done to update accreditation standards?
What the board does is, as you can appreciate, this was a major reform implemented with a very short lead time, and the National Board has, where possible, adopted existing national standards, whether they be accreditation standards or other documents that it believes were underwent robust development and consultation prior to the new scheme, and so it has adopted those where possible. It has invested enormously in developing new standards and codes and guidelines where they're either missing or there has not been alignment across the country with the states and territories. and it has a significant work program ongoing to address those existing documents going forward, and also to develop new documents that will guide practice. And this is a priority for the board, and realises that it's got a work plan established to prioritise that work and to ensure that over the next 3 to 5 years we will have a very robust and very well supported and understood framework around professional practice, around accreditation, and as you can appreciate, things change and new information comes on board, and that will obviously inform as well.
Alyson, you're speaking at IIR's Clinical Training and Workforce Planning Summit on the 29th to 30th of August 2011 in Melbourne. What would you like delegates to gain from your presentation?
I guess to get a better understanding of the new board, national board's role and its responsibilities, particularly in balancing the requirements for regulation and protection of the public in particular, but also understanding the need for a well-educated, competent nursing workforce that's accessible for the needs of the community.
Alyson Smith, many thanks for your time today. We're looking forward to your presentation in August in Melbourne.
You're welcome. Thank you.